All right, 5 minutes. That's 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned in to this dial. Today is Friday. Thank God it's Friday, day 31 in a month of January 2025. Today is the last day. So, if by any chance you were saying, I'm going to take my health serious this month, I'm going to take my health serious this month, this is it. The month has come to an end. Well, no pressure. No pressure at all. So, if by any chance you have been trying and, for one reason or the other, you've not been able to pull through, do not beat yourself up, okay? You just have to keep trying and ensure that you keep prioritizing your health every now and then. This would really, really help you in the long run. My name is Blessing Abiola. Thank you very much for joining me on the show today. This is where I get to welcome you to Radio Doctor. Radio Doctor is your free health consultation program where medical doctors consult for free and advise on Women Radio. Radio Doctor is broadcast Mondays through to Fridays on Women Radio 1.7. And yes, we do this basically to talk about our health. And of course, Radio Doctor is Nigeria's first specialized radio health program where medical doctors consult for free and advise on your women radio. Like I said, we do this Mondays through to Fridays, 10 a.m. through to 11 a.m. My name is Blessing Agweto, and our radio doctor for today is Dr. Abiola Ajayi, the MDCU of ROA Specialist Hospital. Good morning, Dr. Abiola. It's so good to have you on the show today.
Good morning, Blessing.
Good morning. How are you doing?
Doing fantastic.
All right. On Radio Doctor today, Dr. Abiola Ajayi, the MDC of ROA Specialist Hospital, will definitely be consulting and advising on infertility in men. What you should know. I know by now you already have an understanding that infertility is not restricted to just women. I know that many a times when we have conversations about infertility, we're quick to blame the woman. We're quick to ask the woman, oh, what have you done in the past? What did you use your body to do? What did you do in your past relationship? I mean, most times we don't get to question the men about this. So yeah, this is to let you know that men can be infertile as well, and that is why we're having the conversation on the show today. You can call us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. That is how to be a part of the conversation for today. All right, Dr. Abiola, I would like us to start the conversation this way, more like a 2-in-1 question. How would you describe infertility in men, and what are the main causes of infertility, of male infertility?
Thanks for doing this topic. It's a really dear topic to me. In the last, let's say, 2.5 years, my practice, almost half of what my patients now are infertility cases. And infertility is, the technical definition is having three episodes of unprotected sex a week for a year, not producing a child. But in Nigeria, we're so sensitive about, giving birth and having children. I can't really stick to that definition. If a couple comes to me at 6 months and say we've been trying for 6 months, I usually start my workup. If they're worried about it at 4 months, I usually start my workup, just looking for something, trying to relieve stress. And just like you said, the family usually looks at the woman and said, what's your problem? What did you say? What do you use your body to do? All those kind of things. And she is usually under a lot of pressure. 95% of the time that somebody comes into my office to talk about infertility is the woman. And she, most of the time, comes by herself. And I have to tell them the same statistic I'm going to share with the listeners now is that male infertility is responsible for 40 to 50% of infertility cases worldwide. So it's about half. So when you see 95% of the blame or the effort falling on the woman, it's a little bit sad, and I hope these kind of conversations will definitely improve that statistic. But 40 to 50% of infertility cases include the male factor. And some of the causes of male infertility are low sperm count or no sperm. And then you can have poor sperm motility. Sperm have to swim, and poor swimming. You can have abnormal sperm shape, and you can have what I see often. You can have infections like prostatitis or sexually transmitted infections that can damage sperm or block sperm transport. Sperm come from the testicle, take tubes up to the prostate, and they wait there for ejaculation. So there are a lot of different conditions that can block the movement of sperm, and that's how I usually look at male infertility. Especially if you have low or no sperm count. Is something affecting the production of sperm, like a hormonal issue or a genetic issue, or is it something mechanical, like an infection that has blocked the transport of sperm? But those are the main causes, and you also have lifestyle factors, which are directly tied to male infertility, like smoking, excessive alcohol, and drug use.
All right, thank you very much, Dr. Abiola, for your thoughts on the show for today. I mean, you said something about low sperm count, no sperm at all, and I'm just inquisitive. How common is infertility among men, and what age group is most affected?
Yeah, so low sperm count is something called oligospermia. No sperm count is something called azoospermia, and just meaning low sperm count, meaning you have less than the average, which is about 15 million sperm per milliliter. It's very common. Infertility alone affects 1 in every 6 couples worldwide, and like I said before, almost half of those cases are attributed to a male factor. So quite common. I believe those numbers are a bit higher in Nigeria because of environmental factors. But in Nigeria, studies have shown that we at least 1 in every 5 couples will be affected by infertility. That's 20%. So those are great numbers. I've been seeing increases in my practice of people trying to treat infertility or trying to get information. You asked about age. The men can produce sperm all through their life. But after the age of 35, the sperm quality starts to decrease. And then it takes another sharp decrease 5 to 10 years later, so in your 40s. But technically, men continue producing sperm all through their life. But as you get older, the sperm reduce motility, meaning they don't move as well. And then you have something called DNA fragmentation. And that just means the DNA within the sperm are broken into pieces that are not compatible. And sometimes you'll see that exhibit where sperm will fertilize an egg and there's a miscarriage within the first 12 weeks. And oftentimes people are wondering, what did I do? Oftentimes is because the genetic material was not good. And we'll talk about that later. There are things that you can do about it. Another important thing to note is that, we're always talking about what women do to get infections. 35% of male infertility cases in Nigeria are due to infections, particularly sexually transmitted infections. So, both men and women have roles to play in infertility.
All right, thank you very much for your thoughts on that one. Now let's talk about lifestyle for a minute, because I know quite all right that lifestyle, most times when we have conversations about, oh, we should do this, we should do that, particularly about our health, there is always concerns about the lifestyle of people. So what role does lifestyle, such as, say, diet, exercise, alcohol consumption, and all of that, what role do this lifestyle play in male infertility?
Plays a huge and significant role. It's important to know that lifestyle factors are cumulative. So if you have a poor diet over time, that will just make things worse and could contribute to infertility. If you are drinking alcohol, it's cumulative. So No, not the first year, not the second year. Over time, it will contribute. So, like for diet, there's some compounds called antioxidants, and that's usually if you have a diet high in antioxidants, these things like vitamin C, vitamin E, zinc, selenium. These support sperm health. But I'm always talking about diet, right? It's truly important. It really makes a lot of the difference. And then we have a diet that has excessive sugar, excessive processed foods, excessive trans fats. These can also reduce sperm count and quality. So diet plays a major role. Another lifestyle, living lifestyle factor is exercise. It's been shown that moderate exercise improves not only your testosterone, which is the male hormone, and also increases sperm production. Now, if you're doing excessive training, maybe you're training for the Olympics or a marathon, at times that can reduce your sperm count. But moderate exercise, what most of us engage in, can improve testosterone and sperm production. Alcohol is a big one. Heavy drinkers, it lowers your sperm count, it impairs sperm production, it lowers your testosterone, which can cause erectile dysfunction. And we've talked about erectile dysfunction before, and I'm sure we'll talk about it again. Smoking, and that's smoking of anything. Tobacco is the worst of them, but smoking can reduce sperm count and increase DNA damage in the sperm. And then there's some drugs. Some of the ones that are more common are steroids, opioids. Opioids are like very strong painkillers, and marijuana are all known to negatively impact sperm quality and testosterone levels. So if you're able to control, and funny enough, when I'm treating male infertility, and even at most stars female infertility, this is kind of the roadmap in which I go through. Yes, I'm going to run some tests, look at hormone levels, and do all those things. But I hammer this home that dietary changes, moderate exercise, reduce alcohol, reduce smoking, and avoid certain drugs can do wonders for your sperm count, erectile dysfunction, and fertility.
All right, thank you very much, Dr. Abiola, for that one. That is really, really loaded. I do appreciate you for your thoughts on that one. And I love how you mentioned that certain medications, opioids, and all of that can actually contribute to male infertility. So let's talk about stress and mental health. Is it possible? Because some people would say, because they are broke and all of that, they are unable to perform well. So is there like any linkage, like any correlation and all of that between your stress and mental health impact and how it impacts male infertility?
There's a direct link. And this is why now occasionally I will introduce stress management techniques to patients. I've introduced patients to meditation, to visualization, to stretching, to yoga, because over time I've realized how important your mental health is to almost every disease state. But we're talking about infertility. It's chronic stress can elevate a hormone called cortisol. It's a stress hormone. And cortisol directly suppresses testosterone, which is the male hormone, and reduces sperm production. So that person that's stressed, they say they were broke and this and that, and if they now experience erectile dysfunction, it would make sense because high cortisol, low testosterone gives you erectile dysfunction. It can even reduce libido, your interest in sex. And then on top of that, when you combine that with unhealthy habits, people that are often stressed or depressed don't eat as well, so they now have poor diet. They may want to smoke more. They might want to use alcohol more. And then those that are stressed often don't sleep as well. And sleep disturbances further lower your testosterone levels. So it's important to, I think I've mentioned before, I'm practicing integrative medicine now, which is where you try and look at the root cause of a problem. So before, let's say 2-3 years ago, when I'm trying to treat infertility, I'm going to check your testosterone level, your hormone level, anything that's low, I'm just going to give you injections or tablets to boost it. Now I try and dig deeper and find out, hey, is this person suffering from stress, poor sleep, unhealthy eating habits? And we try and fix those problems as well as the laboratory values, and I've seen success rates here have doubled since including all those techniques. So it makes a huge impact.
All right, 20 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, this is Radio Doctor. Radio Doctor is your free health consultation program where medical doctors consult for free and advise on women radio. Okay, so you can call us on 9155 917 917 or 800 1235 917. Dr. Abiola, I would like to ask you for a moment, what are the most common tests or procedures that are used to diagnose male infertility?
Yeah. The first thing we're probably going to do is something called a semen analysis. Is where you evaluate the sperm count, and a sample is produced usually in the office here, so it needs to be read quickly. You need to look at the sperm or the semen under the microscope within 20 minutes, or the sperm will die. They don't live very long outside of the body. And I used to have early in the day, 7 years ago, people would try and bring samples from home for testing, and by the time you look at it under the microscope, everything is dead. So you get false results. But the semen analysis, we often do a culture just to see if there's any infection in the semen. So that's very important. Then hormone testing. So we're going to look at your testosterone levels. We're going to look at different stimulating hormones like FSH, LH, prolactin, and try and detect some hormonal imbalances. Hormonal imbalances directly affect not only your erections, but your sperm production and sperm quality. I usually do a scrotal ultrasound. So an ultrasound is a scan of the scrotum, and we're looking at the blood supply to the testicles. And we're looking for any dilated veins or anything that could cause blockages, or at times increased dilated veins can cause increased heat in the testicle and reduce sperm production. And then there are very few cases where we now screen for genetic conditions, where we're trying to look at your DNA and see if there's any issue with your chromosomes. Don't do that often. Usually by the time we do the first group of tests, we've usually found what we're trying to accomplish. But if we have some very special cases, we involve genetic testing as well.
Very much for your thoughts on that one. So, how does sperm quality, let's say the count, motility, and morphology, how does it even affect fertility that we're talking about?
Yeah, sperm, we talked about it. Sperm count is, you're going to look at it under the microscope. You're counting how many sperm, how many healthy, how many just typical sperm you see in 1 milliliter of sperm. We're looking for 15 million sperm and above. And I see anywhere from, 15 to 200 million. It's just everybody's different, but if you can have 15 to 20 million sperm count so that's just the absolute count. Then you're also looking at motility. Motility is, movement, and I like 50%, but some of the textbooks use 40%. You want 40 to 50% of the sperm moving very quickly under the microscope. And about the same goes for morphology. Morphology means shape. So sometimes you look under the microscope, a sperm may have 2 heads. Okay, that's not normal. It may have a very short tail or a very large head, or there are 100 different variants. But you want at least half of them to appear normal. That improves the chance of the normal shape, improves the chance of fertilization. So those are the main ones I focus on. There are other parameters which really don't impact it as much, but the count, the motility, or the movement, and the shape, very important.
All right, thank you very much for your thoughts on the show for today. I really do appreciate you, Dr. Abiola. It has been an enlightening one, particularly that part that you mentioned that a man can suffer from low sperm count or even no sperm count at all, and how you also talked about that equality of the sperm can actually affect the quality of the fetus. So thank you very much for taking out time to explain that to us today on Radio Doctor. So let's talk about this one. What are the potential effects of sexually transmitted infections, STIs, on male fertility, or it doesn't even have an impact at all?
No side effects of sexually transmitted infections, STDs in the U.S., STIs in Nigeria, can have great effects on male fertility. Some of the STIs are things like chlamydia, gonorrhea, which used to be called the clap. I don't know if they call it that in Nigeria, syphilis, and even HIV. All of these can have potential effects. They can cause something called orchitis, which is inflammation of the testicle. And anytime the testicle is inflamed, swollen, overheated even, it can cause damage to the sperm producing cells. This will now reduce your sperm count and your sperm motility. And, I keep talking about temperature. If I have a man that complains of low sperm count, or we found low sperm count, and he's a long distance trucker, and he wears tight fitting, briefs all the time directly, that's already a problem, because increased heat in the testicle can directly damage your sperm and reduce your sperm count. And on top of that, of course, like we mentioned here, STIs can definitely do that. And the longer that STI is untreated, the more damage that can be done. And that's the same for men and women. But we're talking about men today. It can definitely affect your fertility.
All right. Thank you very much for that. 27 minutes past 10 from Women Radio 91.7, Nigeria's best and only radio station for women and their families. Yes, if you're just joining us, this is Radio Doctor. Radio Doctor is your fifth house consultation program where medical doctors consult for free and advise on Women Radio. It is broadcast Mondays through to Fridays, 10 a.m. through to 11 a.m. My name is Blessing Adeto, and our radio doctor for today is Dr. Abiola Ajayi, the MDCA of ROA Specialist Hospital. And today on the show, we're talking about infertility in men, what you should know. And so far, Dr. Abiola has enlightened us on what it even means when a man is infertile. And he has talked about the causes of infertility. He has talked about how common it is among men, even the age group that is mostly affected. He has talked about the impact of lifestyle, diet, exercise, alcohol consumption, and all of that. He has also talked about how certain medications can actually contribute to male infertility. He highlighted the impact of stress and mental health on male infertility and all of that. So he said so much on the show. If you would like to ask him any question on the show, please call us on 09155 917 917 0800 1235 917 or 07000 917 917. You can ask Dr. Abiola any question and we'll be glad to provide answers to your question. Yes, you can also send us a message on 0703 175 6537. Dr. Abiola, let's talk about the environmental factors. I know we've talked about how sexually transmitted infections can actually have the side effects on male fertility and all of that. Let's talk about the environmental factors. Let's talk about the exposure of toxins, radiation, and all of that. How do this influence fertility in women, in men?
Yeah, the environmental factors, and I mentioned that there's slightly different figures for male infertility, opposed to the U.S. and Nigeria, and I think some of that may be to environmental factors like exposures to toxins. There's some things called heavy metals like lead, mercury, cadmium. These can all impair your sperm function, and when you have, I'm not blaming. I don't know of any I don't know of any particular cases of this, but I do know this happens. You have factories producing all manner of things in Nigeria, and their waste just gets dumped into the canal or dumped into the ground or it's dumped into the creek right behind or river right behind the factory. I've seen this with my eyes. A company making paint. Oftentimes there used to be a lot of lead in paint, and there may not be that much lead, but there are other heavy metals and other toxins in paint. The waste goes into the canal that empties into our waterways. Some of it gets absorbed into our drinking water, our boreholes. It ends up into the lagoon where people fish. That fish ends up on our dinner table, and some of these environmental toxins can directly affect male infertility. There's another thing, pesticides. There's a pesticide. A lot of people even have it in their home. Starts with an S, ends with an R. I won't mention it more than that. And use it for everything. Roaches. That pesticide, number one, is known to cause cancer in humans. And number two, continued exposure can directly affect male and female infertility. And then industrial chemicals. I see this often because you have people working in factories again, exposed to industrial chemicals without proper mask. This surgical mask or the COVID mask that we're used to does not block most of these toxins, right? So just having a handkerchief or a little mask over your face doesn't mean you're not getting exposed, and that can disrupt your hormones and your sperm function. And then the final category, radiation exposure. These are like X-rays, chemotherapy, etc., can directly damage the DNA in sperm. Earlier we talked about DNA fragmentation. That's directly can be caused by radiation, meaning it breaks up the DNA into pieces that are incompatible with life. And typically, if that sperm fertilizes an egg, that will lead into an early miscarriage before 12 weeks. So, I don't know how to tackle this problem. That's more of a social, environmental issue. But yes, any of these things can directly influence your fertility. So if you know you're living close to a factory or your water may not be regulated, or you have even air, even exposure into the air, chemicals and heavy metals in the air can also affect it. So you may want to look into that.
All right, thank you very much for that one. So, are there any genetic or, let's say, hereditary factors that can contribute to male infertility in your experience?
Yeah, there are a lot. I could probably name about 20, but the most common ones are there's something called cystic fibrosis, and that's a genetic issue. Klinefelter syndrome. I've honestly not seen it besides in textbooks or so. But Klinefelter syndrome means that you have an extra chromosome. You have women have XX, men have XY, and Klinefelter will be XXY. So that typically leads to testicular failure. And I'm sorry, I've seen one. I've seen one where it was a very young guy. Testicles were normal in size, normal blood flow, a little bit odd in appearance, but not that much, and no sperm count. And later on found that it's Klinefelter syndrome, which is, like we said before, a genetic abnormality. And then if you have any abnormalities on the Y chromosome, you can have something called micro deletions or small deletions, like from exposure to X-rays or radiation or things like that. That's now a genetic factor that can contribute. And if you're able to fertilize and impregnate and a child, and that child is born, then you can easily pass all of these on to that child as well. That's why sometimes I tell people that early miscarriage may be the body protecting you from having a child with even more issues.
All right, thank you very much for your thoughts. I am sure that a lot of people would have been able to learn one or two things from the conversation thus far on the show for today. 09155 917 917. That is the number to call to be a part of the conversation for today. send us a text and WhatsApp message on 0783-175-6537. Dr. Bia, let's talk about hormonal imbalance for a moment. I mean, when we talk about hormonal imbalance, in my head, I'm always thinking, oh, this is especially as a woman. Um, do men also go through hormonal imbalance, and what role does it play when it comes to male infertility?
Yeah, short answer is yes. Men do go through hormonal imbalance, and you'd be surprised. I'd still say it's about 90% of couples believe that is the woman that is the only one that has hormones, or maybe the woman is the only one that has hormones that can be out of balance. Men go through it all the time. Some of them are low testosterone, prolactin being high is another hormone. And then I talked about it then before, FSH and LH. So FSH is called follicle stimulating hormone. The other one's called luteinizing hormone. These hormones they're secreted by your brain to some of them tell your testicles to make sperm. Some of them tell your advanced sperm maturity. And any disruptions in any of these hormones can impair sperm production. So it's crucial that if I'm dealing with a man with a low sperm count, even no sperm count, that we take a deep analysis of his hormones. And the good news is that you can typically use medications to adjust them, and then we also focus on those other lifestyle issues like we mentioned. But it's very important to run those tests.
All right, thank you very much for that one on the show. Now that you even mentioned that there is treatment options and all of that, let's talk about it. What are the treatment options that are um, available for men who have been diagnosed with infertility? Is it like it's something they have to live with forever, or there is a solution some way, somehow?
I tell patients this all the time, especially those that look frustrated. For everything God created as a problem, He created a solution. And it may not be the solution you want to hear, but there's always a solution. You know, when we have a hormonal imbalance, then we can now do hormonal therapy. And when we say a hormone imbalance for a man has affected sperm production or sperm quality, it's important to know that men regenerate sperm. So, you know, men that can grow sperm all the time, but sperm have to mature. They don't come out with the head and the tail, everything at the beginning. They're just round cells, and they later mature into a mature sperm, and that takes anywhere from mid 75 to 90 days. You know, so I always tell people, whatever we're doing, if it's hormonal treatment or medications, you need to stick with it for at least 3 to 4 months before we're going to see improvements. And if I'm starting with a sperm count of 2 million and I can double it to 4 million in 3 to 4 months, then that's a significant improvement. And it's important to continue what got us there. You know, we talked about blockages and dilated veins in the scrotum, and those are called varicocele, and there's surgery that can correct that. I usually do that surgery through a very small incision, probably about not much larger than the width of my thumb, and can bring out the testicle, can remove those dilated veins, and oftentimes that helps. When we're looking at the infections, you know, I mentioned when we look at the sperm test, we look at the infections. Of course, there are different antibiotics that can help for that. And I'll keep mentioning that lifestyle modifications are treatment options. So that's healthy diet, moderate exercise, avoiding smoking and alcohol. All of these play a huge role.
All right. Thank you very much, Dr. Abiola, for your thoughts on the show for today. Let's talk about the preventive measures. How can men prevent themselves from being infertile?
Yeah, the some of the things that our regular listeners would know I like to talk about. Maintaining a healthy weight is one of the best things you can do, and you do that through a healthy diet. We've talked about. I even wrote my diet plan. I think I've talked about it here. I've sent it. It's on all our social medias. It's called Dr. Jai's Guide for Long Life and Prosperity. That same diet plan will help you maintain a healthy weight, will help you protect your fertility, will make you happier in the bedroom, happier in your head. All your body functions are tied to your diet. So that's one of them. Then avoiding smoking, alcohol, and what we call recreational drug use, because we've already said it directly impacts your sperm and even your testosterone. But can't I stress enough how much getting enough sleep and managing stress is? Your immune system, not only does it fight infections, but it's your repair system. So, we go through the day, little things get damaged in our cells, little things get damaged in our body. And for the most part, a lot of that repair happens while you're sleeping. So if you're kind of a person that's constantly sleep deprived or depriving yourself of good sleep, or to poor sperm, every day that you don't get poor sleep, the worse things, don't get good sleep, the worse things can become. And I'll add one: practicing safe sex to prevent sexually transmitted diseases. We talked about how those can affect us. So, making sure you know who your partner is, be tested. All of those kind of things are make a big deal, make a big difference.
All right, thank you very much, Dr. Abiola, for your thoughts on the show for today. I really do appreciate you. Even I, as a woman, I have learned so much from today's conversation. I really just want to say thank you for taking our time to enlighten us on this. Um, I know you mentioned obesity and all of that, but I just want to ask, how effective are treatments like in vitro fertilization, I mean IVF and ICSI for male infertility? I know you've also mentioned treatment options and all of that, but talking about these treatment options like IVF and ICSI, how effective are they when it comes to male infertility?
Yeah, that's a very good question. We've talked about treatments where we're trying to improve sperm and sperm quality, and hopefully you can impregnate your partner easier with those treatments. But we do use IVF often for low sperm count. Success rate, it should be about 40 to 50% per cycle. It's a little bit lower than that. What I've experienced in Nigeria. Oftentimes, when somebody says they've used IVF to get pregnant, you have to immediately ask how many cycles. So if it's 40% on average per cycle, then 2 to 3 cycles may be what it takes before you get pregnant. And the reason why we don't see IVF used as much here is because it's so expensive. And it's so expensive, and some people will sell land and sell a car and scrape all the money they can together to do one cycle, and then it doesn't work. Then what do you do for the next one? But it's useful. It's a very useful tool, and I pray that it becomes more affordable. Another one you talked about, ICSI. It's a way of you when you collect sperm from the male. It's a way of amplifying it. You add some buffering solution. I do it often. Add some buffering solution, and you're now trying to inject a single sperm into an egg, and then that also that's a bit cheaper than IVF, and it also carries about the same success rate, about 40% per cycle. So they're all viable. You just need to make sure that you're aware of, number one, the success rate of the institution that you're using. How many cycles on average does each person or each couple have to do? And then even ask that if I have to repeat a cycle, will I have to pay the same amount, or is there a way that it could be a bit cheaper? But we use both.
All right, Dr. Abiola, I would like us to talk about genetics for enrollment. If somebody has male infertility? Like maybe at some point the father suffered male infertility, or if there is an history of somebody coming down with male infertility in the family, can it be hereditary? Can somebody else has it in that family?
Yes, the yes, the good news is that that is not as common to transmit male infertility, but yes, it can because we talked about some genetic conditions like Klinefelter, cystic fibrosis, etc. All of these can be passed on to your child. So the short answer is yes, but it's not as common as the other factors that we mentioned. And it's important to give that if you're a man now suffering from male infertility and you're discussing with your doctor and you know about that history, then it's important to let your doctor know so that remember I said I don't do genetic testing as often, but if I were to hear that history, then I would order genetic testing as part of my early workup, so we can quickly find out what and if something can be done.
All right, the conversation today has definitely been very, very, very insightful. Honestly, I feel like there is so much to learn, and we've learned so much on the show. So, as we wrap up on the show today, Dr. Abiola, what will you advise to every man listening to the sound of your voice?
The number one, every problem, male infertility, even though it's significant, it's treatable, often treatable. Please do not put everything on the woman. I last time I had to ask a woman to call her husband and give me the phone. And I said, please, you need to just come in and do your sperm test. She's been here for 3 months and you've not done your sperm test once. Please don't be chauvinistic. Please don't be that type of man. Male factor is a significant portion of infertility. Come and do your tests. And if you're fine, you're fine. But if not, then there's treatment for it. And to encourage your listeners, I would like to tell 15 men that contact us first, either on social media or call in. We will do sperm testing for them. All they need to do is come in, and we do that for WFM people. So there should be nothing to be afraid of.
Wow. Thank you very much, Dr. Abiola, for your kind gesture. I mean, you do this often and often on the show. We're really, really grateful. We just want to say thank you for your time on the show for today. Dr. Abiola Ajayi, the MDC of ROA Specialist Hospital. We say thank you for today's free consultation and advice on infertility in men and what they should know. Thank you very much for coming on the show, Dr. Abiola.
I love it. I really appreciate it. Take care.
All right. Dr. Abiola is the CEO of ROA Specialist Hospital. So just like you said, you want to go for the free testing, you want to take advantage of it, or you even need consultation, please reach out to Dr. Abiola Ajayi, the MDC of ROA Specialist Hospital on 0913 579 5108 0913 579 5108. You can also call 0816 601 4901 or 816 601 4901 for your appointment, direction to hospital, and what have you. And yes, you can also connect with Dr. Abiola on any of the social media pages below. Facebook, it is ROA Specialist Hospital. On Instagram, it is ROA Specialist Hospital as well. On YouTube, it is ROA Hospital. On Twitter, it is ROA Hospital. Or better still, you can check out his website on www.theroahospital.com www.theroahospital.com. At this point, I would like to say a very big thank you to you for taking out time to join the conversation for today. Thank you very, very much. This is Radio Doctor on Women Radio 91.7. Radio Doctor is Nigeria's first specialized radio health program, broadcast Mondays through to Friday, 10 a.m. through to 11 a.m. So do want to join us again on Monday as we come together for a fresh edition of Radio Doctor on Women Radio WFM 91.7. Many thanks to the producer, Aisha Sonny, and of course Michael for helping out with today's production. And many thanks to the executive producer as well, Sean Okewale Shonaya. My name is Blessing Agbeto, and it is always important or very important that you do your very best to stay safe and healthy because of good health is, more expensive than what it will cost you to stay safe and healthy. So as you go about your daily hustle and bustle today, ensure that you do all you can to prioritize your health because health is wealth. Good morning.